Well, a new study is linking COVID reinfections to an increased likelihood of getting other serious health conditions.
It comes as the Omicron subvariant BA.5 that's better at reinfecting people than any variant so far is now becoming the dominant strain in the U.S. The study looked at more than 5 million patients treated in the VA health system and found that people with 2 or more documented infections had more than twice the risk of dying compared to those with just one COVID-19 reinfection. Researchers say reinfection also increased the likelihood of getting lung and heart problems, diabetes, digestive and kidney disorders, as well as neurological problems.
Meantime, California's COVID positivity rate is now 14.8%, about 2/3 of the state right now in the high community transmission level. And joining us live now, UCSF's Chair of Medicine, Dr. Bob Wachtal. Thank you so much for taking the time, Doctor. I know you've been tweeting this weekend about the BA.5 variant. You're calling it a different beast with a new superpower. Can you explain why it seems to be so much better at evading our own immune responses?
Yeah, it is. It's a bummer because we're all ready to be done with this thing. But this particular variant, unlike the prior subvariants of Omicron, has enough alterations in that spike protein, that's what our immunity is targeted at, to make immunity from prior infection just not as robust and not as reliable as it has been with prior subvariants. So the kind of superpower that we used to talk about, you had an infection, particularly if you've also been vaccinated, and you don't have to worry about it. That's just no longer true. Unfortunately, we're seeing a fair number of reinfections.
And of course, the Bay Area has some of the highest case rates in the states. And we'll put San Francisco's latest chart on the screen right here. You can see we have hit a plateau for a while, but cases, well, they're ticking up again. Can you give us a sense of how we're doing as far as cases and hospitalizations? And how do you see the BA.5 surge playing out over, well, the next few months?
Yeah, that curve is you can look at that and say, oh, we're seeing a little bit of a surge now, but nothing like January. The problem is in January, we didn't have a lot of home testing. And so I'd take that blip that we see now and multiply it by about 5. And if you do, we're already at a place that's not that far off from where we were in January. And you probably know that as you hear about friends and family that are getting it in the last few weeks. The problem is we're now, BA.5 is just entering our world now. And so we're going to start seeing another surge. Hard to know how big it's going to be, but because this variant is even more infectious than the prior variants, each one seems to get a little bit better at infecting people, and on top of that seems to be better at evading immunity, then I think it's likely that we're going to see more cases over the next couple of months.
You know, we have been talking to friends and family. It seems like some of them are getting really sick with this one, surprisingly so, but we do know that other people are spreading it asymptomatically. So you have said we need to rethink how we respond. So how should things change? Are we talking about going back to masking or social distancing? What do you think we need to do differently this time around?
Well, I don't think mask mandates are coming back anytime soon unless our hospitals get filled with COVID patients. And at least so far they're not. I'm at UCSF Medical Center right now, and we've got about 50 patients with COVID in a 600-bed hospital, nowhere near like what we had in January. So it still is a milder illness than what we've had in the past. But because you don't have to wear a mask doesn't mean you shouldn't. And I believe there's a lot of COVID around. And if you don't want to get it, then you need to be careful in crowded indoor spaces. And so I still wear a KN95 when I'm indoors, when I'm shopping, when I'm on an airplane. I'm not doing indoor dining. And the reason is not so much that I'm scared of dying of COVID. There's no evidence that this one's any more severe than the past one. But I am scared of long COVID, both prolonged symptoms, and as you said with that study, people who have a higher risk down the line of things like heart attacks and strokes based on a prior case of COVID. So I do recommend that people continue to be careful because there's a lot of COVID around. And as you look at that curve, it's deceptive because it's more than that curve shows because of the number of cases diagnosed with home testing.
Okay, always good information. Dr. Wachtal, thank you very much.
My pleasure.
Still ahead, the concern